And now to a KRDO 13 Investigates report. Assembly line medicine and a sweatshop atmosphere. That's the charge being levied against leadership at Peak Vista Community Health Centers. Providers, including doctors, nurses, and clinicians, have filed a federal unfair labor practice charge against the healthcare group. A representative says at least 10 medical providers have either been fired or resigned in the last month alone. And they say it's due to unrealistic expectations when it comes to patient caseloads. Peak Vista serves patients with or without insurance from the Pikes Peak area to the Eastern Plains. Up to 90,000 people, young and old, walk through their doors for care, according to the nonprofit's most recent available tax forms. But it's that caseload that has medical staff overwhelmed. It's prompted this unfair labor practice charge against Peak Vista, filed with the U.S. National Labor Relations Board. According to this letter from the Union of American Physicians and Dentists, medical staff was directed to increase their patients from 22 to 28 per day, a demand they say forces staffers to spend just 15 minutes with patients.
The national average for patients seen per day in settings like this is 20.
Andrew Gutman is an organizer with a union. He says leadership demanded that providers either work on their days off or extend their work days for the rest of the year, both without pay. And if anyone pushed back, they were fired or, in one case, pulled out of the exam room while with a patient.
These firings look very much like retaliation. We estimate about 10,000 patients have lost their primary care provider in the recent firings over the past 2 weeks.
Providers were informed of the new expectations to address the organization's financial struggles at Peak Vista. But as of 2 years ago in tax filings, Peak Vista had a balance of more than $82.5 million. We did receive a statement from Dr. Emily Potasic, President and CEO of Peak Vista Community Health Centers, who writes, "We are currently investigating the filing. We take these accusations very seriously and are confident they are unfounded. At Peak Vista, we strive for organizational excellence and adhere to the shared values of respect, stewardship, and teamwork among the nearly 800 team members serving 74,000 patients, many of whom have barriers to quality health care. We are committed to a healthy workplace where performance goals and timely healthcare service delivery is a top priority." Now, the allegations are being reviewed by the National Labor Relations Board. If approved by a number of employees, the group would be allowed to form a union. We will keep tracking this one.